We know the CDC has advised people not to travel for Thanksgiving, to stick with their small bubble of people in their household. But it's clear from airport data that people are on the move. And here to talk it through with us is Dr. Robin Colgrove, an infectious disease specialist at Mount Auburn Hospital. Good to see you.
Hi.
All right. So if people are traveling, which they are, that's what the data shows. What is your advice for them? If you're not following these advisories, how can you make this as safe as possible?
Well, reconsider would be the first advice, but assuming that's off the table, I would say that there's no one thing that every little bit helps. And the image I would like to have people have in their mind is try to minimize the number of, to be technical, infectious viruses that get from the person infected to the person susceptible. And that means every piece of it, how far away you are, how long you are together, whether they are wearing a mask, whether you are wearing a mask, whether the ventilation is good, whether there's crowding. You should be paying attention to each one of those things because each one makes a difference.
Those layers of protection that we talk about, right?
Mm-hmm.
So the state has passed 200,000 COVID cases. We logged the last 25,000 in just 12 days. That's a rate that's similar to the height in April. Considering what you are seeing with patients, with trends in this data, do you think that we are anywhere near flattening this new curve?
It sure still feels like we're on the way up here. I mean, there are sophisticated mathematical models trying to predict where the peak would be, but I don't think we really know. We are clearly accelerating. But unlike in the spring, there's a difference between case numbers, which are just skyrocketing, and hospitalization numbers and the numbers of severe cases and the number of deaths. So we're doing better at flattening the latter ones, the severe cases and the deaths, as we get better at treating.
So to that point, we know people are still in the hospital. Those numbers are slowly ticking up. Tell us generally, what is the treatment plan when someone is hospitalized? What's the course of action?
Yeah, ironically, it's easier to say this now than it was during the last wave during the spring because we know that most things don't work. There are only a very limited number of things that have been shown to be effective. In fact, there's only one agent that's been shown to decrease mortality, and that's dexamethasone, a steroid. So for most people hospitalized who need supplemental oxygen, they should be on that. That's one. The only other approved agent, remdesivir, which is a direct antiviral agent that suppresses the viral replication, that has not been shown to decrease mortality, but has been shown to improve speed to recovery, which is a good thing. So for people with mild to moderate disease, sick enough to be hospitalized, they would be on those things. In addition, there are a number of supportive measures, for example, putting people in a prone position to breathe, or putting them on anticoagulants to stop them from clotting, that in some have made a difference in how well we're able to treat these patients.
Okay, so we have made some progress, when it comes to treating this. Dr. Colgrove, thank you for your time. Happy holidays, whatever you're doing.